Welcome to our channel. Today, we're diving deep into an important topic, blood cancer. We're going to cover everything from the basics to the latest breakthroughs in treatment. Now, blood cancer is a complex group of diseases that affects the production and function of your blood cells. If you're feeling anxious or overwhelmed, don't worry, that's totally normal. Knowledge is power, and understanding blood cancer is the first step towards fighting it. We'll discuss the different types of blood cancers, the warning signs and symptoms, and the latest diagnostic procedures and treatment options available. It's important to remember that early detection is key when it comes to blood cancer. The sooner we catch it, the better the chances of successful treatment and recovery. This video is meant for educational purposes only and is not a substitute for professional medical advice. If you have any concerns, please consult with a healthcare professional for personalized guidance. So, let's get started and empower ourselves with the knowledge to fight blood cancer. Let's break down the three main types of blood cancer: leukemia, lymphoma, and myeloma. Leukemia affects your white blood cells, which are your body's infection fighters. It starts in your bone marrow, where blood cells are made, and then spills into your bloodstream. Lymphoma, on the other hand, affects your lymphatic system, which is part of your immune system. It often starts in lymph nodes, which are small, bean-shaped organs found throughout your body. Now, there are two main types of lymphoma, Hodgkin lymphoma and non-Hodgkin lymphoma. They behave and spread differently, so it's important to know which type you're dealing with. Lastly, we have myeloma. Myeloma affects your plasma cells, which are a type of white blood cell that produces antibodies to fight infection. When myeloma cells grow uncontrollably, they can crowd out healthy blood cells and damage your bones. Each type of blood cancer has its own set of subtypes, each with its own characteristics and treatment approaches. We'll discuss these subtypes in more detail in future videos. Blood cancer can manifest in a variety of ways, and sometimes the symptoms can be quite subtle. One of the most common symptoms is persistent fatigue. You might feel tired all the time, even after a good night's sleep. Another red flag is unexplained weight loss. If you're dropping pounds without any changes to your diet or exercise routine, it's worth getting checked out. Frequent infections are another cause for concern. Blood cancers can weaken your immune system, making you more susceptible to infections. You might find yourself getting sick more often than usual or taking longer to recover from illnesses. Other symptoms to watch out for include fever, chills, night sweats, swollen lymph nodes, easy bruising or bleeding, and bone or joint pain. Keep in mind that these symptoms can also be caused by other, less serious conditions. However, if you experience any of these symptoms, it's crucial to consult with your doctor to rule out blood cancer or get an early diagnosis. Diagnosing blood cancer involves a multi-step process to determine the specific type and stage of the disease. Your doctor will start by asking about your medical history and symptoms. Then they'll perform a physical exam to check for any abnormalities, such as swollen lymph nodes or an enlarged spleen. Blood tests are crucial in diagnosing blood cancer. A complete blood count, or CBC, measures the number of different blood cells in your blood, including red blood cells, white blood cells, and platelets. Abnormal levels can indicate the presence of blood cancer. A bone marrow biopsy is another important diagnostic tool. It involves taking a small sample of bone marrow from your hip bone to examine under a microscope. Imaging tests such as X-rays, kinetic scans, MRI scans, and PET scans can help visualize the affected areas and determine the extent of the disease. These tests use different technologies to create detailed images of your bones and organs. The good news is that there are many effective treatment options available for blood cancer, and advancements are being made all the time. Chemotherapy is one of the most common treatments. It uses powerful drugs to kill cancer cells or stop them from dividing. Chemo can be administered intravenously or orally, depending on the specific drug and the patient's needs. Radiation therapy is another common treatment option. It uses high-energy rays to damage and destroy cancer cells. Radiation can be delivered externally using a machine outside the body or internally using radioactive materials placed inside the body near the cancer cells. For certain types of blood cancer, stem cell transplantation may be an option. This procedure involves replacing damaged bone marrow with healthy stem cells from a donor, often a sibling or an unrelated donor from a registry. CAR T-cell therapy is a revolutionary new treatment that involves genetically modifying a patient's own immune cells to recognize and attack cancer cells more effectively. Recovering from blood cancer is a journey, and long-term care is essential for managing the disease and preventing complications. Follow-up care is crucial to monitor your recovery, manage any side effects from treatment, and detect any signs of relapse early on. Your healthcare team will create a personalized follow-up plan based on your individual needs. Lifestyle changes can also play a significant role in your recovery. Eating a healthy diet, getting regular exercise, and managing stress can boost your immune system, improve your energy levels, and reduce the risk of complications. Support systems are essential during this time. Surround yourself with loved ones who can offer emotional support, practical help, and encouragement. Joining a support group can also connect you with others who understand what you're going through and provide valuable insights and coping strategies. Remember, you're not alone in this journey. Thanks for watching. If you found this video helpful, don't forget to like, share, and subscribe for more health-related content. We've covered a lot of ground today, from the different types of blood cancer to the latest diagnostic procedures and treatment options. Remember, early detection is key when it comes to blood cancer. If you're experiencing any unusual symptoms, don't hesitate to reach out to your healthcare provider. They can assess your individual situation, provide personalized guidance, and address any concerns you may have. Knowledge is power, and by understanding blood cancer, we can take proactive steps towards prevention, early detection, and effective treatment. Stay healthy and informed.